A lot of times patients ask what's the difference between, or the advantage between, an implant and a bridge. It has to do with the fact what the patient wants, what are the needs for the patient also. So for instance, let's say these two teeth were virgin teeth. They weren't touched before, they didn't have cavities, they didn't have crowns. So that's a situation we don't like to damage teeth by putting a bridge on virgin tooth structure. So the best next option would be to get an implant. If the patient doesn't have enough bone, we might have to graft it, which means to put in some scaffolding material that is taken over by the patient's own bone cells, and it creates bone. And after that, we go in and we place our implant and restore it, put a crown on that implant as if it was a natural tooth and we were getting it ready for a crown. In such a fashion, we don't have to damage the adjacent teeth. Now, what is a bridge? A bridge involves, as I said, more than a single tooth. We try to replace a tooth that's missing by splinting a fake one to the adjacent teeth. So for instance, here we have the missing tooth, which we call a pontic. The adjacent teeth are called abutments. What we do in this situation is we prepare these adjacent teeth as if we're making an individual crown for them, but actually what we're doing is we're splinting all three together. So it will look something like this. This is an older temporary, it's a little bit discolored by now, but as you can see, we're restoring the missing tooth. When a patient comes in and we prepare the patient for a bridge, he always or she leaves with a temporary prosthesis, what we call provisional. It's made out of a softer material. It's not meant to be in the patient's mouth for a long period of time. If it is, we have to replace it every so often or strengthen it because of its weakness. It could fracture, it could leak, which means that the margins are not accurate. And then after we take impressions, we send everything to the lab, and the lab follows our directions as far as what type of material to use, how to fabricate it, and adjust the occlusion accordingly in order for the patient to have a comfortable bite. Patients, due to the finances, prefer to do a bridge over an implant because an implant is more costly, or they don't want to deal with the surgical aspect of getting an implant. So those are the parameters that affect the decision on the treatment sometimes.